I'm Paul Boland. I'm Healthcare Director at EBO. And I suppose just for the next few minutes, I'm going to talk to you a little bit about the case for transforming outpatients, which I'm sure will be close to your hearts. The need to do so in a way that puts the patient at the centre, and how patient-facing automation can help to transform outpatients in a personalised way that works for patients. So much of this won't be a surprise to you, but traditional models of outpatients haven't kept pace with the changing needs of patients. And I suppose we're still working to systems that were brought into practice in the 1940s. And obviously, with us delivering 88 million outpatients appointments in 2022, the reality is that demand has outstripped capacity. And it continues to grow year on year. And we simply don't have the capacity in the system to keep working the way that we are at the moment. So there's a real need to deliver more efficient services for patients, a need to ensure that every interaction with patients is appropriate and that it adds value for both the patient and the clinician. And I suppose what's interesting here, and I see now that my graphics have gone awry, but you get the picture. Actually, this is graphics according to Salvador Dali, right? So yeah, it's a reinterpreted. But anyway, these quotes were taken from focus groups that were run with patients about their experience in outpatients, actually in Wales, and the source is there down the bottom. And when you get these slides afterwards, this will be corrected, don't worry. But these were taken from focus groups that they ran in terms of their outpatients transformation strategy for Wales. And I think what's interesting about the quotes is they don't relate to people's experience of their clinical care. It's about the simple, mundane stuff, It's about stuff like, give me more control over my care. Give me the ability to self-manage my appointment. Tell me where I can park when I'm coming in for my appointment. Simple stuff. But we all know in our day-to-day lives that if this stuff isn't right, it's stressful, It's unnecessarily stressful for patients, okay? So patients want more control. Then, of course, we have the major issue of elective recovery. So we heard already this morning, and I listened to Sir Jim Mackey a couple of weeks back at a very good Convenzis event on elective recovery, and he was making the point that the real issue is in outpatients. So we know this, 85% of waiting patients are in outpatients, right? Of the 88 million outpatients attendances in 2022, 61 million were follow-ups. Were all of these necessary? Of course not, okay? So that's a contributing factor as well. So I suppose the case for change is strong, and there's lots of interrelated issues and reasons why we need to look at it. And what we do in EBO is we help NHS providers to automate patient conversations, okay? So we look for administrative bottlenecks in the system where you're trying to communicate with patients en masse, where those interactions are repetitive, at scale, and you're struggling to basically handle those the old way, using armies of staff on the telephone or maybe sending letters. So systems that we've worked to for many decades but are maybe becoming a little bit out of date, okay? So what we do is we use a combination of technologies. Yes, artificial intelligence, because what we do is we automate the conversation. So we use natural language processing for that part, okay? Then we also use integration, workflow, and business intelligence, dashboards and reporting to automate the patient process end to end, okay? So we fundamentally believe that the best way of automating a process is to enable the patient to have a conversation. Even if they can't speak to a real person, we think there's inherent advantages in having a conversation-based approach, okay? So these are some of the patient pathways that we're automating today. So NHS trusts are already using this technology They're already doing this, okay? There's no end of patient-facing processes that we could automate. There's no end of bottlenecks. And actually, we're finding lots and lots of different use cases across the system. So for example, in Somerset, we're managing over 1,000 outpatients bookings conversations per month. 40% of those are handled out of hours, interestingly. And patient feedback's really high across the board, with patient satisfaction scores as high as 95%. At Shropshire Community, we're handling consent to treatment for school-age immunisations and vaccinations, a process that was paper-based, and we have 100% adoption on that project from parents. So that's just to give you a little feel of where this is being used and for what. So what have we learned from all this experience and all these projects? We've learned that engagement is not about a portal. It's about having meaningful conversations with empathy, right? Even when one of our clinicians or one of our staff can't speak directly to the patient. We've learned that engagement is not simple, it's not easy, there's no quick fix. It's a multi-stakeholder collaborative process with key measurable outcomes. We've learned that engagement isn't automatic, can't be assumed. It requires continual work with your communications teams, continually engaging with patients to let them know there's new channels of communication available, and building trust with patients to change behavior. And we've learned that engagement is not about installing a piece of technology. It's about building communication pathways that are effective. So the solution I'm talking about today contains lots of different building blocks. So just to give you a sense of what's involved. So you can be assured that underpinning our solution, we're ticking the compliance boxes. So things like DTAC and data protection and security. We've got those things covered because we've had to go through those processes on the existing projects we're working on. We have integration capabilities. Why is this important? If you're going to automate conversations with patients, you'll want to make those patient context specific. That probably means you have to draw on data from the patient record. So yes, we do integrate with EPR and PAS systems, okay? When we've handled the conversation automatically with the patient, we then push the outcome from the conversation back into the relevant system. We use workflow and business rules so that we can take decisions automatically as the conversation's happening. So we can score responses to questions, we can trigger actions and alerts off the people or teams off the back of the conversation. We can have multi-channel broadcast capabilities or omni-channel communications. This is about saying you need to give patients choice in terms of digital channels. It's not a one-size-fits-all. So we cover the obvious digital channels like SMS and email and the NHS Trust website, but we're also available on messaging channels such as Facebook Messenger and WhatsApp. Now you might say that's pie in the sky, but actually that's what we're using in our day-to-day lives. So why don't we let patients use those channels when they're talking to their health provider? Look, if we're serious about giving patients choice and putting them in control, let's make it easy for them. So maybe not on day one, but certainly as an aiming point, you need to know that these solutions are future-proofed. And if we're automating conversations, why not do it in lots of different languages? Why not remove the language barrier completely? So we do that as well. Elective recovery is what I want to major on. So the first thing we can help you with is waiting list validation, right? So this is obviously a popular theme at the moment. And what we're saying to you is that we can use our solution to automate those conversations with patients to land a validated outcome in any language, and you have total control over that conversation that happens with the patient. And I'll show that to you in a minute. We can also help you with smart booking of cancelled slots. So patient-led appointment booking. So we're doing that with a number of trusts today. And so ultimately you'll want an integrated solution that allows you to have a validation conversation and then maybe go on to offer maybe a clinic at short notice, possibly out of area to that same patient, and we can handle that for you. And then this solution is also ideally suited to patient-initiated follow-up, and see on symptom pathways. So this is the first kind of use case that I want to talk about. It's Betsy Cadwallader in North Wales. So BCU for short are using this solution to do waiting list validation in both English and Welsh. So what we've delivered to BCU is a solution that enables them to communicate with patients via SMS. The patient clicks the link and has an interactive two-way conversation with an AI-powered virtual assistant to land a validated outcome from that conversation. And then we've put an end-to-end process around that for them. It includes a dashboard, a real-time dashboard to show them exactly where they're at with things, and a number of other elements moving towards full integration with their PAS in the next phase. So this is what it looks like. So I'm the patient. This is my phone. In comes an SMS message, and then I click the link in the SMS message. And now I'm into an interactive, automated conversation. In the demo, it's quite simplistic, but it could be any dialogue flow whatsoever. We design those dialogues with you. We can answer questions in real time, okay? And we can do that in any language, okay? So basically what we're giving you here is total control over that conversation without you having to have staff behind it, okay? And we take, patient feedback. We can link to My Planned Care, et cetera, et cetera. It just depends on how you want that conversation to flow. And then we have an admin portal where you can view the patient lists, and you can see that prior to the patient list, there was no response, but afterwards we've updated it with remove no longer required. So the validation team can use this portal to oversee all of their activities. And we have screens built which allow you to manually update the fields that you need to update so that we can extract it, you can work with it, and we can use it as the basis for updating your EPR or PAS as well. So this is available as an integrated solution or as a standalone solution, where we could do one-off validation for you, maybe leading to a more integrated model when you're happy with the process, okay? So that's what it looks like. And just to zero in a little bit on that dashboard, okay? So this was the dashboard that I showed you. And what I want to highlight is, I think we're getting a validation response rate of about 66% on this project, which is kind of in line with SMS-based communications. But I think what I'd like to draw attention to is, of the responses we got, we outcomed 100% of those, right? So I talk to people who are using a telephone-based chat solution, letters, etc. And I don't think those solutions are giving you 100% outcomed validations. You might get a response, but then you lose people en route. We're getting 100% from this. So where we engage with people, we deliver a validated outcome. And I think that's really interesting to see. And once again, my graphics are playing wonders here for me. But anyway, you get the picture. We're talking about number of communications down here, right? So you'll see that we're sending multiple communications. That gives us an opportunity, obviously, to increase the number of patients we engage with. And I think these are the kind of metrics that we've agreed with Betsy Cadwallader. But there might be other things you want us to display. We can do that. But basically, what we're giving you is full control of the conversation and full oversight in terms of where you're at with those conversations. Do patients welcome automation? Well, we get really good feedback from patients. In fact, these are the kind of statistics we're getting at Somerset, where we're doing appointment management, okay? 89% of patients say they're satisfied with the experience of using an AI-powered virtual assistant. It talks to the themes that we've already mentioned earlier. Patients want more control over their own care. They're happy to use digital solutions if they're made available. I think that this statistic would reinforce that. I want to show you the booking solution that we've got now. It takes about 2 minutes, but I want to show you that the solution does more than just validation, okay? So one of the big challenges around outpatient transformation in this regard, in terms of reducing the admin burden, is around appointments. And what I'm showing you here is a really, really quick and easy way for patients to manage their own appointment on your Trust website, okay? It doesn't require them to register with a portal. It doesn't require them to go and navigate around the internet or a portal and figure it out for themselves. They just visit your website, and within 2 minutes, they've self-served for their appointment. What we find is that most patients just want to find out when their appointment is because they cannot find that letter because it's buried under the kid's homework or the dog ate it, you know? So they just want to find out when it is. It takes 2 minutes. They go on your website and they've self-served. And they just say what they need. And our solution serves up the answer. So once we've authenticated the patient and we know they are who they say they are, then we can get into a meaningful conversation with them. So we're pulling this data from the EPR, the PAS system, okay? So I would consider this to be a next generation portal or patient engagement platform. It uses the fact that most of your patients are visiting your Trust website. Between 50 and 100,000 patients a month you're getting on your Trust website. When they're there, engage them. Give them the opportunity to self-serve. The patient just says what they want. Our solution understands their intent, and we respond accordingly, okay? So we're pulling the data, we're serving it up to them. They don't have to navigate, they don't have to search. And now we present the appointments as so. They just choose which appointment they want to cancel, and then you know straight away. Because I think for outpatients particularly, they're not necessarily going to be repeat customers of the hospital. They don't maybe have long-term conditions. And we find that portals, traditional portals, plateau at 15 to 20% uptake. What about the other 80%? How are you going to reach those? I think most of those are outpatients who are single-turn patients. They expect to be in and out. And they want a quick way of interacting with you. They don't maybe want to have to register for a portal that, they expect to be dealing with month on month. So automation is about giving time back. And what we do is we give you an end-to-end solution that helps you to automate patient-facing processes. And we'll analyze the effectiveness of this solution with you on a weekly and a monthly basis, and we'll give you really good insights into whether the solution is performing or not. How is EBO different? It's fundamentally different in terms of digital patient communications because we put conversation at the heart. We say, even if your staff aren't available to have a direct conversation, that doesn't mean you can't have control over that interaction. You can. And conversation's natural. It's two-way. It's interactive. Patients should be able to ask a question and get an immediate response. And we should be able to understand whether they're expressing pain, and we should be able to respond with empathy. And we can do all of that now with automation solutions. And that has value. So finally, I just wanted to talk about our innovation fund. So obviously money is tight, and we want to look at inventive ways to give you an opportunity to try innovations like this. So focusing on patient validation, we're offering a validation managed service, which allows you to take advantage of our innovation fund. So we'll part fund it, which brings the price down to just £1,000 setup. So you bring us a waiting list, small or large, and we will set it up for you. We don't have to integrate, and we will charge you £1.50 per validated conversation. So it's a results-based model. We don't charge for no replies, okay? So, it really is a case of you're only paying for the value you're getting. It takes us 2 weeks to set it up from the time you give us the patient data to us sending out the first communication to your patients. We can do it in any language. We can set up whatever rules around it you like. We can design the dialogue specifically for you according to each specialty. And hopefully this gives you an opportunity to maybe try a new way of working before you maybe make a major investment. Okay? So that's it from me. Thanks a million for your time. Come and have a chat to us at the stand if you'd like to find out more information. Okay.